16 minutes, a negligible segment in a person's life, one might say, even imperceptible. However, sometimes the seemingly inconspicuous moment negates all those millions of minutes that came before it.
Get out of here. I need to get out of here. I need to get out of here.
Matt.
I need to get out of here.
I know, honey.
The story begins in 2006 with a man named Sherman Shizimore. By the time this story unfolded, Sherman was 73 years old. He had led a worthy life, spending a significant part of it working in coal mines in West Virginia. It's crucial to note that this is not an easy and very dangerous job. There is a constant risk of gas poisoning, and there is always the danger of tunnel collapses. However, Sherman avoided all of that. By the age of 50, he left his job in the mines and became a priest in one of the churches in Charleston. By this time, he had been married for over 20 years and had adult children. People in the town respected him for his past, his family values, and simply because everyone considered him a good man. Now, after getting acquainted with the key character of the story, let's transport ourselves to its pivotal date, January 2006. It all started on January 19, 2006. That evening, Sherman and his wife Ruby were home alone. They were sitting on the couch, engaged in their usual activities. Sherman was reading the newspaper, and Ruby was watching TV. Suddenly, Ruby, hearing Sherman's wild scream, jolted. Sherman turned towards her. He was looking straight ahead, screaming wildly, as if he had seen something terrifying. However, there was nothing unusual in front of him, just the walls of their room. Ruby asked Sherman, "Why are you screaming?" However, the man, falling silent, simply continued to stare ahead. His face still betrayed that something was wrong, his eyes were wide open, and he hardly blinked. Of course, panic immediately set in for the woman. She embraced her husband, trying to reassure him. Seconds later, as if previously out of his mind, Sherman turned and said, "Don't leave me, or they will kill me." Ruby had never seen her husband like this. His behavior, to say the least, was very strange. Certainly, it was a reason to call for an ambulance, but the woman was confident that her husband would handle this problem himself. Moreover, in a couple of minutes, he seemed to calm down and behaved quite normally. However, that evening, the episode recurred. Ruby decided that she just needed to get through this day, wait for the morning. Perhaps, on the next day, these strange seizures would subside. However, the woman was deeply mistaken. Waking up in the morning, she, as usual, saw her husband lying next to her. However, his eyes were wide open again, and he lay silently, staring at the ceiling. It seemed like he wasn't sleeping at all. That morning, it became evident that this man's life had not returned to normal. Ruby was in a panic. She called her adult children and asked them to come. However, when Sherman realized that someone had to come to their house, he told his wife, "Don't let them in. They planned to bury me alive." From that moment on, the only person he wasn't afraid to be with was his wife, Ruby. The Sherman family was bewildered. How did this calm, strong, thoughtful man turn into a true paranoid in just one day? What was the reason for this? Yes, he was already in old age, but senile dementia does not occur so suddenly, with a snap of the fingers. In one day, this man seemed to lose his sanity. Sherman had to leave his job because he was afraid to leave the house. Very rarely did nights pass peacefully for him. His wife noted that he either didn't sleep at all or, during sleep, emitted terrifying screams. All of this continued until February 2, 2006. This happened 2 weeks after the first episode. On that day, February 2nd, Sherman Shizimura ended his torment and, along with them, his life, with the help of a gun. After his death, he left one enormous question: what drove him insane literally in one day? Several months before Sherman had his first episode, he began experiencing severe abdominal pain. To find out the cause, he went to the hospital with his wife and daughter. There, the man underwent the necessary diagnostics, and the doctor informed him that the most likely cause of the pain was in the gallbladder. However, to determine this with certainty, a diagnostic operation was necessary. The essence of the operation was to visually assess the condition of the gallbladder. The abdominal pain was severe enough for Sherman to agree to the surgery, and it was scheduled for January 19, 2006. On that day, Sherman arrived at the hospital with his wife in a perfectly normal mood. It wasn't the first operation in his life, so he didn't feel anxious. In the morning, the standard preparation for the surgery began. Sherman lay on the operating table while the medical staff performed the necessary procedures before the operation. The man engaged in a friendly conversation with them. Then, he received a dose of anesthesia, and approximately an hour later, the operation was completed. On the same day, Sherman was discharged home. However, it was precisely on this day that Sherman, after the operation, became a different person. So what happened during this quite ordinary surgery? The family of the already deceased Sherman managed to obtain the protocol of the operation, and showing it to an independent expert revealed the following: everything was normal until the administration of anesthesia. During anesthesia, an anesthesiologist was supposed to introduce several substances into the patient's body. Some were responsible for relaxing the patient's muscles, and others were intended to induce a medical sleep anesthesia. So, Sherman was administered only the first group of medications. His body was completely paralyzed, and he couldn't move or speak. The only thing he could do was move his eyes from side to side. However, his eyes were covered with a bandage, so no one saw this. Hearing the surgeon asking for a scalpel, Sherman horrifyingly realized that he was still conscious. He felt everything, but couldn't show the slightest sign indicating it. Sequentially, he experienced intense pain as the surgeon made incisions on his abdomen, secured his skin, manipulated instruments inside Sherman's body, and ultimately touched his gallbladder. All of this lasted for 16 minutes until one of the nurses noticed Sherman's eyes, the edges of which were slightly open due to the bandage slipping. The nurse immediately exclaimed, "He's still conscious," and only then did the anesthesiologist realize that he had forgotten to fully anesthetize the patient for a whole 16 minutes. Sherman endured excruciating pain. It was a genuine torture. Of course, the question arises, why didn't he tell his family about it after the operation? There is an answer to this question. The medical staff realized they had made a serious mistake. It was evident that there was a high probability the man would file a lawsuit against the clinic. Therefore, the anesthesiologist additionally administered a drug called midazolam to Sherman, a medication that induces short-term memory loss. It was precisely the action of this drug that prevented Sherman from fully comprehending what was happening to him. Yes, he didn't remember everything that happened to him, but echoes of the torments he endured remained in his body, in his subconscious. It was precisely these echoes of wild pain that drove 73-year-old Sherman Shizumura insane. Later, Sherman's family filed a lawsuit and won in 2008. However, the amount paid by the hospital is not disclosed. It's worth noting that similar cases sometimes recur. For example, according to some data, in the United States, on average, 1 person out of 1,000 continues to feel pain during surgery, either fully or partially. This mostly occurs due to errors in the actions of an anesthesiologist.
Get out of here. I need to get out of here. I need to get out of here.
The video was published by the mother of one of the patients after hernia removal surgery. The guy claims that he also felt everything happening to his body during the operation. After this, he, like Sherman, experienced constant panic attacks. Fortunately, in the case of the guy, it did not lead to the tragedy that happened to Sherman. It's challenging to imagine the pain Sherman felt if only 16 minutes proved fatal for this resilient and courageous man.